salud y servicios humanos. Usted va a ver esos cambios en los correos electrónicos y las comunicaciones con el nuevo logo, nombre y colores, pero esto no va a afectar nada de ninguno de los servicios.
Thanks, Wendy. We're working to make these meetings more accessible to those who speak other languages. If you would like to try the closed captioning in another language, right-click on the closed caption box at the bottom right of the screen. A menu will come up, then click on Translate into English. A box will open at the top of your screen where you can choose which language you would like the captioning translated into. We also have someone here to help, Wendy, who will help translate questions for Spanish speakers. Wendy?
Yeah. Estamos trabajando en hacer estas reuniones más accesibles para aquellas personas que hablan otros idiomas. Y si usted quiere tratar de usar los subtítulos con el closed caption en otro idioma, puede hacer el clic en el derecho y puede escoger el idioma que quiere. Por favor, también ponga su micrófono en mudo ya que esta reunión será grabada. Y si tiene alguna pregunta, lo puede escribir en el chat y yo traduciré su pregunta. Gracias.
Thanks. And before we get started today, we wanted to remind you that this meeting is being recorded and it will be available Friday on the DSPD website under Individuals and Families, and then the Be Informed and Be Involved heading. Please mute yourselves and type any questions into the chat box or email them to dspdinfo@utah.gov.
También está, ya lo había mencionado anteriormente, la reunión está siendo grabada, so si puede poner su micrófono en mudo. Y esta grabación estará disponible este viernes y estará en el enlace que tiene el título Be Informed and Be Involved. Y si tiene algunas preguntas, también las puede escribir en el chat o las puede mandar por correo electrónico a dspdinfo@utah.gov.
Wendy, thanks so much for being here tonight to help us and translate. Our agenda today will cover the following topics. So we'll have announcements, we'll have a short presentation on the Disability Ombudsman, we'll have updates on how we're implementing the appropriations from the legislature this year, updates related to COVID. We'll do a presentation on the employment preparation services, and we have Olyvia here from the Developmental Disabilities Council to share some community resources, and then we'll close with a question and answer period. So the announcements we have are, if you have an RFS request, so when you're in services, this is how you request additional services, please work with your support coordinator directly on that request. They submit the information, they're your advocate, and they'll be working with you on that request. So please work closely with them. When you call members of the RFS committee, it just slows down their ability to get requests reviewed. And it does make it harder for them to be objective as they evaluate service needs. And it is important for them to be able to be objective. Also, for those of you who use Leonard Consulting, they're only going to be serving people with DSPD through June 30th. If you use Leonard as your fiscal agent, please work with your support coordinator to make the transition to another fiscal agent as soon as possible. The 3 remaining fiscal agents in Utah are all able to serve additional people. You're welcome to make the transition anytime before July 1st. And even if you don't want to transition until July 1st, it's still important to have that paperwork done to make sure everything's in order and things go smoothly. I'm now going to turn some time over to Heather Barnum and Tyler Black to give us an Ombudsman update. Thank you both for coming.
Thank you for having me. I'm Heather Barnum. I work with the Department of Health and Human Services, and I'm in the Executive Director's office. And I'm excited to share the progress that we've made on the Ombuds program for disabilities. And that is something that, and Tyler can give more information about this, but it's something that we've been studying for a while now. We had a legislator who was a sponsor of a bill. Daley Provo was the sponsor of the bill, representative, and she was able to get that passed in the last 2022 session. And we're so grateful that we have some starting money and an opportunity to hire someone to begin this program in Utah. And what we are doing is, instead of having this individual serving in DSPD, we've decided to put this individual at the department level as a program administrator director. And that individual will be in the Office of Ombuds in a brand new division called the Division of Customer Experience. And what this benefits is that this individual is not helping necessarily to advocate for services on the waiver. This is someone who is dedicated to working with any member of the community who has a concern about their disability being accessible in different places of business, or in any place that you might attend in the place that they live. Any of those services could be elevated to this individual who can help to advocate and resolve those concerns with the person who maybe needs to make some changes. So I'm really looking forward to getting this program started, and most importantly, to seeing it expand. So we'll be sharing more information about that when we get this individual hired. We have some really strong candidates, some who have even done this type of program out of state. And so we'll bring some of those expertise if they are selected for the role. And Tyler, did you have anything more to add about the work that's been done up till this point about the need for this service in Utah and how it will operate?
Yeah, just a few things. Thanks, Heather. Hi, everybody. My name's Tyler Black. I'm an administrator with the Division of Services for People with Disabilities. And as Heather mentioned, this is something that we've been working with the original sponsor, Representative Daley Provo, on a study that came out of the 2020 legislative general sessions. We were asked to look at barriers that Utahns with disabilities experience, what the duties of an ombuds office in the state of Utah could be, and to develop a proposal for what that office could look like. So we conducted the study over the course of a year. We did some surveys and some interviews with existing agencies in other states, and presented to the House Health and Human Services Interim Committee in October of 2021. You can find more information if you're interested in learning more about what that study showed. It's on our website, dspd.utah.gov/legislative-info. I'll put it in the chat as well. But what we found in that survey is that when we were studying the barriers that people with disabilities experience, the top 3 barriers that Utahns with disabilities experience are knowing who to contact with a problem, navigating public infrastructure, and communicating a problem to an entity. And those are all 3 things that an ombuds could help with. So we're really excited about this new office, and House Bill 150, which was sponsored by Representative Daley Provo, passed during the 2022 general session, which created this new agency in the Department of Health and Human Services. So we're excited to be working with the Division of Customer Experience, and we'll continue to give you updates as that program gets off the ground and moves forward at our quarterly meetings. So thank you.
Thank you both. Heather, are you jumping off after this presentation? So we just want to open it for any questions related to the Ombuds program, if you have any, while we still have Heather with us. Okay, well, thank you for joining us, Heather. And well, hold on, we got a hand. Go ahead, Gabriella.
Thank you, ma'am. Sorry, I wanted to ask you a few additional questions. With the Ombudsman, do you know when they will take effect in their position? Because some of us are not receiving like the help that we need, and we're hoping to have some of that guidance prior to them starting their current position. Who would you direct us to communicate with if we needed some of this help prior to them starting that position?
So as far as the timeline goes, we just closed the position, and actually, thanks to some seed money from the Division of Services for People with Disabilities, we're starting it sooner than was directed in July. So we'll have this individual starting in the next couple of weeks. Now, that doesn't mean the program is going and up and running. It's a brand new service. And so we do need to give this person time to create it. And one of the main responsibilities from the start will be to engage with all of you and get feedback on what that program needs to be and how we need to provide the information to those who need it most. So it will take time to develop, but certainly you will be engaged. As far as who to contact right now, if you have questions, that's part of why we need this program, right? What Tyler's report concluded was that we don't have something like this and that individuals need to know where to go. So as of right now, Angie or Tyler, where do you recommend that individuals pose their questions or concerns about accessibility until we can get this program up and going?
My first thought would be reaching out to independent living centers. There are 5 throughout the state. They work with people to kind of try and navigate some of that right now. They were definite advocates in supporting having a disability ombuds because they see that need as well. If it's related to like services that you're waiting for on the waiting list, I would make sure you're reaching out to your case manager, making sure your information is updated. I know that we do have a waiting list, but we do also strive to like make sure we get services to people when we can. Anytime we have one-time funding available, we try to make that accessible to people as well. So definitely reach out to your case manager. If you don't know who that is, you can email dspdinfo@utah.gov, and we'll be able to get that information to you.
I had one more question. So with my situation, I have a minor. And so when I've called the independent living centers, they've stated that the Ombudsman is mainly for elderly or aging disabled individuals. And so it wouldn't necessarily apply in my situation. And so I'm feeling like I'm not really having someone to go to. Is there anyone else that you feel would factor in to help me kind of get my concerns and questions answered that would specifically help with a disabled minor child?
Gabriella, let me clarify. So right now, the state of Utah does have a long-term care ombudsman that works with aging population. That program has already been going for many years. This is a brand new program for exactly what you're saying. We don't have someone who can help specifically with individuals with disabilities that need that extra care. So I think they're just referring to what the state already has in place, and you're exactly right. As far as helping with your individual needs right now, I think, Angie, those are the best contacts. But we hope to get this going very quickly because we know there is a great need.
One more question, sorry. And so with the development period, do you know how long that usually takes for that to be implemented and in place?
It will be up to the individual that we hire and how quickly they can get that going. But obviously, we're motivated to get it going as soon as possible to already be taking cases fairly soon. But of course, we want to build it correctly so that it can have some long life in the state as well, and even give us the opportunity to expand the program based on the need. we're as anxious as you, so we really appreciate your questions today and are with you in wanting to see this happen soon.
So when that's implemented, how is that going to look for us as far as like contacting them or getting their phone number? Will that be posted on DSPD, or will it be something you send out as far as like how to get in contact with such individual?
Yep, part of the money that was given by the legislature was for marketing the service. So education and outreach is a big part of people. If you don't know that the service exists, then you won't be using it, right? So that is a big piece of what the individual will need to do in getting the program going. Keep
Okay.
attending these calls. I would imagine you will get updates as things go. And so really appreciate your questions.
Thank you.
And I would just add to Heather's point, we have our communications officer online with us too, and she'll be helping make sure we do have that available, right? As we send emails out, hopefully you're getting them. And if not, definitely also email dspdinfo@utah.gov so we can get you on our mailing list and make sure you're getting that. And I think the feedback of getting something on our website, even if it's not in our office, that'll be a good place to make sure people can see it at least for a period of time. So thank you for your feedback.
Thank you.
Any other questions for Heather while she's with us?
Okay, thanks everybody.
Thank you, Heather. Okay, so now we'll go over some legislative updates. I think we've already talked about, we received appropriations. So for fiscal year 23, the legislature funded $6 million to bring about 400 people into services. DSPD will be bringing people into services in small groups. So that 400, that number, people will be coming into services across the year. We've started transitioning monthly groups of clients into services from the waiting list, and services will begin on July 1st for this first group of people. So we're really, really excited for this opportunity to support families. 90% of the funding will be used to bring people with the most critical needs off of the waiting list. This means that people will be brought into service based on their placement on the waiting list. And about 10% of this will be used for the limited supports waiver. DSPD identifies individuals eligible for the limited supports waiver based upon a low needs assessment score. So when you're at the top of the waiting list, you have a high needs assessment score. And for the limited supports waiver, we're looking at a low needs assessment score. And then to prioritize from that, we will be focusing on who's been on the waiting list the longest to determine the order of enrollment. For the period of April through June, we're providing one-time supports to nearly 200 people who are on the waiting list. This is funded using our carry forward monies. We anticipate being able to distribute additional one-time funds for people on the waiting list beginning July 1st of 2022. So on the waiting list status, if you have questions about where you or your family currently are on the waiting list, direct this to your caseworker. They can help you with that. That again, dspdinfo@utah.gov, and we can let you know who your caseworker is if you don't already. We also received increased wages for staffing. We have heard from many of you about the challenges faced by the lack of provider capacity and the staffing challenges as they were experiencing staffing shortages. We really appreciate all of your advocacy that went on during the session. We're really happy to announce that as of April 1st, an increase of 19.54% to providers' rates was initiated. Per legislative intent, that means providers must use the rate increase for the sole purpose of increasing the salary and benefits of all staff positions that spend 60% or more of their time providing direct care to people. No portion of the increase is allowed to be allocated for administrative functions, provider profits, or retained earnings. We continue to search for solutions to the staffing challenges faced by our provider system, and we know that we will continue to partner on strengthening our system. Anecdotally, we are already hearing from providers that this wage increase has allowed them to better attract and retain qualified staff. Even in some cases, staff who had left are returning. So we hope that you're also noticing the impacts of this important change. So caregiver compensation is another thing that was approved one time during the legislative session. Pardon me. It'll go through June of 2020. Let's see, 2022 to 2023. It'll go through June of 2023. And we've got a lot of questions, so we're going to go over some frequently asked questions, and hopefully this will help answer some questions that you may have. So one question we get is, will caregiver compensation become an ongoing service in the future? The ability to temporarily fund additional services was primarily due to funding through federal relief funds during the pandemic. The Utah legislature extended the funding so caregiver compensation can continue through June of 2023. And then the legislature will make decisions about whether to continue funding caregiver compensation after that date. If ongoing service is approved, additional requirements or criteria may be added that could change the scope of the program. Another question that we get regularly is, how many hours can a caregiver provide? The maximum hours a caregiver can provide is 40 hours per week. The maximum each individual can receive is also 40 hours per week. Each request for additional caregiver compensation needs approval from the Request for Additional Services Committee. That's the committee that reviews requests for additional services. The amount approved often varies when looked at in conjunction with other services such as respite, supported living, day services, and school that the individual receives. As a result, the committee often approves fewer than 40 hours per week, but each person's situation varies according to their needs, meaning that every person's budget is going to look different. Another question we get is, if you have more than one child receiving DSPD services or caregiver compensation, can both parents be compensated caregiver compensation hours? Is it 40 hours total per household or per individual and caregiver? So each caregiver is limited to 40 hours per week, and each individual is limited to 40 hours per week. If both parents are providing services to two different individuals in DSPD services who receive caregiver compensation, it is possible that more than 40 hours could be approved for the household. The 40 hours a week is the maximum for any individual. Many individuals are approved for fewer than 40 hours per week. The next question is a family's financial situation taken into consideration when determining the amount of caregiver compensation that is awarded? So caregiver compensation support is provided based on the individual's documented and assessed need. When a person is trying to decide if caregiver compensation is the right service for themselves and their family, the focus should be on whether the service is in the best interest of the person, and it cannot take into consideration the family's financial circumstances. Support coordinators need to ensure that the person is choosing to have their parent or guardian as an employee, and this choice is supported by their person-centered support team. The last question we have on our frequently asked questions is, are step parents considered caregivers for caregiver compensation? And the answer is yes. Step parents can provide caregiver compensation support. On our next slide, we'll be talking a little bit about the limited supports waiver. Tyler, I don't know if you're still on and wanted to cover this, and if not, I'm prepared to. Okay, I'll go over this. As many of you already know, the limited supports waiver became effective at the beginning of this year. This new waiver provides limited supports with spending caps to people with disabilities and their families. While the waiver has not been in service for very long, we are already hearing positive success stories from people who have been able to use this service. One individual and his family had never considered that he would ever move out on his own, and receiving services opened up a whole new world for him. He hated cooking, but now he looks up recipes and makes a shopping list, goes shopping, and then makes dinner with his support. He ordered a pill dispenser so that he can care for all of his medications on his own. He is pretty shy and he's out of school and was spending most of his days on video games and things inside the house. Now he does something at least once a week that is physical, such as hiking, going someplace to jump on a trampoline, going to the park on walks, and other things that he's interested in. He loves doing these things, but he needed support to get into the community to make that happen. And so he has started researching what it would cost him to live on his own, and trying to make more decisions about like what is important to him and what he's looking for in a place. Another individual had a mother who had passed away just days before they were offered caregiver compensation. Before they were offered services through the limited supports waiver. His dad had worked and his mom had taken care of all of the appointments and activities and therapies. His dad had no idea really even where to begin, as you could imagine, like experiencing a loss and then needing to take up some additional responsibilities. So with services, they've been able to receive support to help find resources, help them identify like changing guardianship, getting connected with vocational rehabilitation, to be able to look at working and changing the rep payee with Social Security. They've also been able to receive help with their individual education plan, and just understanding a lot of day-to-day stuff. This has helped the dad to be able to support his son in the services that he needs and receive the support he needs right during this time. This person has had a lot of behaviors in the past and is getting support for that now. And he gets overwhelmed pretty easily and would not answer the phone or not answer people when they spoke to him. He needed prompting for hygiene, and he mostly does, pardon me, he mostly does his hygiene independently now. And he's actually started laughing at jokes. I have a little itch in my throat, and he's recently made his own goals in his person-centered planning meeting. When he got frustrated at his meeting, when he was feeling overwhelmed with questions, he asked to be excused. So he's starting to implement some of the skills he's being taught to manage his, like some of his behaviors. And after taking a break, he came back and was able to continue engaging. And he started making dinner too for his dad, his brother, and himself weekly. Pardon me. We just wanted to share a little bit of like what things could look like with the limited supports waiver, because we know it's new and we're trying to help people be oriented to it, understand what it can provide and how it can impact someone's life. So I'm going to turn some time over to Tamara to talk about some employment updates.
Thank you, Angie. Good evening. It's great to be here. My name is Tamara Blackwater, and I'm the program specialist with the Employment and Community Inclusion team. So the Employment Preparation Service, or the EPR, began on March 17, 2022. Providers and support coordinators have been working to transition each person to EPR service. The Employment and Community Inclusion team have been available to answer questions and continue to provide any assistance with EPR. Information about EPR can be found on the DSPD website, where we have created guidance for individuals and families, support coordinators, and providers. And the link will be provided in the chat. And then also the Employment Community Inclusion email is being created to submit questions, and we will send a link to that email in the future. And if you have any questions prior to starting that email, please send your questions to Bryn Peterson. On to the next slide, please. So, and we'll kind of talk over with the DSPD Employment Pathway Tool. So we would like to present a planning tool that we've developed specifically for people in DSPD services or are signing up for with the wait list. And it's called the DSPD Employment Pathway Tool. This tool walks anyone through a guided conversation on employment. The tool should start a general discussion about any of your interests, preferences, and community activities, and participation, or even your skills. As you continue the conversation, you will focus more on employment and community-based interests and what your supports and environments you need to be successful in those settings. We have a link to the tool that will be shared in the chat. And it is called the DSPD Employment Pathway Tool. We wanted to explain quickly why we created the Employment Pathway Tool, and the DSPD Employment Pathway Tool can be used to walk each person through a guided conversation about their employment interests and desires. The reason we created the tool was to help each person reach informed choice about employment. Informed choice are educated choices. To make that educated choice about employment, we need to be provided accurate and current information, explore all options available, and have some hands-on experience to decide what we want to do. Everyone uses this or a similar approach for any big decisions about life. Maybe it is a decision to move to a different city, medical decisions, schools, and others. The tool provides informed choice for jobs that are competitive and integrated. When you hear people say competitive or integrated employment, or CIE, they mean jobs that are open to everyone in the community. Jobs where you are paid above minimum wage, and a wage that is the same or close to a coworker without disability, and a job where you are working alongside people of all abilities. Each person will be in a different place on their path or journey to employment, and this pathway tool is flexible. It offers some suggestions for conversations or next steps, but you're encouraged to ask your own questions, personalize the conversation, or free to come up with plans that are not included in the suggestions. On to the next slide. The tool starts by asking this basic question: what pathway is right for me? The pathway tool has 4 pathways to choose from. You choose one of the pathways based on where you are right now with employment. Are you unemployed in one of those competitive, integrated, and community jobs, but interested in one in the future? So that would be pathway A. The person is unemployed and expresses interest in work. Are you unemployed in a competitive, integrated community job? Do I hear an echo? Okay, sorry. Are you unemployed in a competitive, integrated community job, but not interested in working, at least right now? So that would be pathway B. Working in a competitive and integrated job, but want some kind of change. There are like more shifts or different responsibilities. That would be pathway C. Are you happy with your situation and simply want to continue what you're doing? So that would be pathway D. The pathway then asks you to choose one of the pathways. Let's move on to conversation questions. Next slide. Each pathway has different questions based on your current situation and desire to work. We ask the questions to help you as a job seeker to fully understand your decisions on and what work could look like for you. Each pathway has suggested questions based on your situation and a box at the bottom of the page to record those thoughts and answers. The questions you ask and the answers you give should help everyone to understand more about you and what you want to do for work. You might be asked, what are you good at? What are your skills and abilities? And what would you like to learn? These are just suggestions. If the person leading the conversations knows you well and wants to ask different questions, or you have something to say that does not fit under any of these questions, feel free to adjust the tool and let them know your thoughts. And that's what's nice about this tool. It's very flexible. I mean, you can ask many different questions, expand on those certain areas of interest, expand on including other individuals along with the tool. You can add, friends and family with the tool. So each pathway has different information. As the discussion continues, you can expect to talk about all the options available to you. You might work together with your support team to understand all the current information out there for work. If you're not interested in working, what other community activities would you like to do instead? From the conversation, the next step is to develop a plan. We'll talk to you about that on the next slide. After you move through the questions about what work could look like for you, the last section simply answers this question on the slide. So what happens next? The tool provides some suggestions you can use as an example in the area of person-centered planning and vocational rehabilitation. All you're doing in this section is writing what you and your support team are going to do next. If you're not interested in a job, usually that means some hands-on experience to expose you to a few different job opportunities so you can make your own choice. If you're interested in working, what happens next would be your plan for how you, your family, friends, support teams, school teachers, and others will help you reach your employment goals. And after you have decided on some employment goals, what happens next could mean thinking about how you will connect with and use resources available to you. You'll also keep tracking these sections and changes or updates to the plan you made, and continue to explore new and expand on interests and experiences. And those are my updates for employment. And that's kind of a little bit of our information on the employment pathway tool.
Thank you, Tamara. On our COVID-19 updates, what I'm not sure how familiar you all are of the American Rescue Plan Act, right? ARPA or ARPA is how people often refer to it. Our state had submitted a plan of how to utilize this increased funding. And one of the ways that we've been approved to use this is through what's called an infrastructure grant. So as we look to continue to strengthen our system and services for people with disabilities as a whole, infrastructure grants are being offered through the American Rescue Plan Act. And we're looking forward to requests that come in. These grants are to improve, enhance, or expand Medicaid home and community-based services. So those are the types of services that are received when you receive services from DSPD. And these grants can help organizations to become fully settings compliant. That's a regulation that has been put out there. It's been out there for quite a few years now, but our deadline for getting aligned with that and having everything in place is March of 2023. So we think that the timing for this is very beneficial. It's going to help us, our system, families, people we serve. The opportunity to submit a proposal is open to any Utah organization interested in improving, enhancing, or strengthening our home and community-based services infrastructure. This includes, but is not limited to, existing home and community-based service providers under any of the 9 waiver programs. 5 of those are with DSPD. 1 is with aging, and the other 3 are with the Medicaid long-term services and supports group. It can be providers of Medicaid state plan services, such as home health and personal care service providers, or nonprofit organizations. Proposals have to be submitted by May 31st by 5 p.m. And now I'm going to give some time to Olyvia Burbidge to talk about some services that they have. So, Olyvia, I saw you on earlier. Welcome and thank you for joining us.
Thank you so much. Give me one moment to share my screen.
Of course.
Alrighty. Hello, everyone. Thank you for having me today. My name is Olyvia, and I work as the Program Support Specialist for the Utah Developmental Disabilities Council. Little information on what the Disabilities Council is. The mission of the UDDC is to advocate, build capacity, and encourage systems change to support people with disabilities and their families to fully and independently participate in their communities. We collaborate with the legislature, public and private agencies that serve individuals with disabilities to strengthen the service system. The vision of our council, we are run by a government appointed council, and the vision of that council is to create a world where all people have what they need to get what they want from life. My job with the council is to oversee the leadership and advocacy goals that improve Utah public policy through developing self, community, and public advocacy skills for people with intellectual and developmental disabilities and their families. And we accomplish these goals through a handful of self-advocate-led activities and groups. And I will be going over those with you now. And I do have a few links that I'll share in the chat at the end of the presentation. So look out for those as well. So the first program I want to speak to is the Advocates as Leaders Speakers Network. This is a group of self-identified self-advocates focusing on providing information and experiences related to disability issues. Each presentation is given by a self-advocate who have expertise in a variety of subjects that impact the lives of people with disabilities. Some of the topics we cover in our presentations are self-determination for everyone, advocacy in the workplace focusing on how to ask for accommodations when you do get hired, the hiring process and the services that are available to you during that time. Other presentations we do is advocating for community change, supported decision-making, and the list goes on from there. We schedule our presentations through our community partners list. This is a group of organizations in the state that work with people with disabilities or companies that would benefit from more information on how to integrate disability culture into their organization. If you're interested in becoming a community partner, I will put the link in the chat after the presentation. That's just a Google form. You can leave your information there and I will get a hold of you. The next program we run is the Alps program, or Advocacy, Leadership, and Policy Success. This is designed for people with disabilities, family members, and allies who want to support the disability community and their families. This is more of an advanced advocacy and leadership training that helps people learn more about how to speak up for larger groups, like the state of Utah or students with disabilities. Alps also teaches people how to make changes to policies that show up in our everyday lives, like who can visit the group home, and when or who gets to live in the community, or who gets support when they learn in school, or who gets to attend higher education programs. We recommend our Alps program for people who have some advocacy and community experience and want to dig deeper into goal setting, community outreach, legislative education, and exploring their creativity in community building. Next, we have the People First of Utah group. I do want you to keep in mind that the same way that the Utah Developmental Disability Council has sister organizations in every state and territory within the US, that is also usually the case for the People First programming. And essentially, This is a community group where like-minded folks, this one specifically focused on the disability community, can get together and plan barbecues or talk about the legislative session or any sort of community action that they want to take. This is a good starting place. This group is currently under construction. It was on its way to being an independent 501c3 nonprofit. It lost some of its footing and it has since bounced back to us. So please do keep an eye out for this in the future. I think this will be a great resource for self-advocates and their families alike. Next, I just have a few different activities that I want to share. This is our upcoming partnership activity with NAMI Utah. It is their Friends and Family program. For those of you who don't know, the month of May is Mental Health Awareness Month. So we've partnered with NAMI. They are a mental health organization in Utah. And on May 26th at 7 p.m., we are going to be holding or partnering with them to hold the Friends and Family programming, which goes through resources and avenues you can take if you are the family member of a person that experiences mental illness. If you do choose to register for this, which I will put that link in the chat as well, just make sure you're choosing the one that says the UDDC partnership event. Again, all of these events are free, but we will all be hosting and attending on the May 26th. So we definitely encourage you to attend that event with us. It'll be nice to see some familiar faces. Now, building off of the People First of Utah, the goal is when that comes to fruition that we would all get to meet once a year at our annual self-advocacy conference. We are still holding that conference this year and it is coming up soon. That conference will take place June 2nd and 3rd. This year's conference theme is A Whole New World, Navigating Our New Reality and Creating Healthy Relationships. This is a free conference for self-advocates. However, you must be 18 or older to attend. And if you have not registered for the conference and want to, or you know somebody who would love to attend, we will be reopening registration on May 16th. So please follow the Utah Developmental Disabilities Council on Facebook, or you can go to our website and sign up for our newsletter. Those are great ways to stay active in information that is coming up and other activities that are available to self-advocates in our community. I'll leave you with some contact information. utahddcouncil.org is our website. And then uddc@utah.gov is a great email address. We are always available to answer questions, point you in the right direction for service providers, or if you are a self-advocate or know a self-advocate, we are a great starting point to build connections in the community. So.
Thank you so much, Olyvia. The DD Council is such an asset and a benefit in our system. Let's open it up for questions that you guys have for Olyvia on anything she presented or just questions that came to your mind while she was talking. Okay, well, you do have her contact information if you have questions in the future or if you just want to get connected. So we'll just open it up for questions and answers now in general. We did have one question emailed in, but I do think we covered it. The question was, how many people are going to be taken off of the waiting list this fiscal year and when will they be notified? So I think we've already mentioned about 400 people will be coming off of the waiting list into services, and they're coming off in small groups over the year. And people are going to be notified at the beginning of the month. So just so you kind of have a good idea of what that cadence is going to look like. Do we have, I saw that Lisa Thornton had a question about where to find information on the infrastructure grants, and there is a link in the chat for that. And so LP, I see your hand is raised. Feel free to speak up.
Hi, Angela. I just had sort of a comment and a question. You mentioned earlier that, you know, if you need assistance, contact your caseworker. And our caseworker, just within the last week, tried to contact DSPD, and it took 3 days to get through to you guys. So my question to you is, I understand, you know, there's funding through the legislature for opening up some different programs, but do you guys have funding to hire more people to help you out?
So this legislative session, we did actually get funding for an additional waiting list worker, which I agree. I mean, we definitely have a lot, whether it's waiting list, people and services, we definitely get a lot of questions coming in. And resources have definitely been prioritized to services. Our waiting list workers have caseloads of over 600, so one more person will help, but they still will have pretty high caseloads. And we are really trying to make sure we get to our emails. So I apologize that it took a little bit of time to respond to your support coordinator. So there's a question in the chat. Is there a link to learn more about the limited supports waiver? We do have information on our website. If I could, I don't know if like Katie is looking for it right now, and we can get that link in the chat. I can look for it at the same time. I don't have it immediately available, but let me get on our DSPD website. Okay, if you, maybe it is not on there yet. I'm looking under our waivers, and we have the community supports waiver, the acquired brain injury waiver, the physical disabilities, and the community transitions waiver. So if we can get a link, like when we post this, we can put a link to where you can find more information about the limited supports waiver. So thank you for the question. That's very good because we do want to make that accessible. Other questions?
Hello.
Yeah, go ahead.
Oh,
Go
hi.
ahead.
You can hear me.
Yeah.
Do you address the people who are on the Medicaid waiver, but then eventually also get Medicare? Is that all handled through Department of Workforce Services?
So, right, Medicare is not handled through our office. You're correct. And I actually am not sure. I have Joseph Ambernack online. He is with our Medicaid long-term services and support. So it is not Medicare, but I am wondering, Joseph, if you have an idea about that question.
Yeah, basically what happens with your Medicaid waiver once you actually start, your Medicaid waiver once you actually start Medicare.
Yeah, and I can help a little bit there, although as Angie mentioned, we don't deal with Medicare directly. That is a separate evaluation that's done by the Social Security Administration. So with the waiver programs, an individual is usually receiving Medicaid state plan services, so access to prescriptions, hospital coverage, outpatient care, and then in addition to the waiver supports that DSPD helps provide. Very commonly, we will see individuals, especially once they reach the age of 18 and they're able to file a claim with Social Security on their own. There's usually a 2-year waiting period before Medicare benefits will also begin. But that, again, that portion is handled by the Social Security Administration and would recommend reaching out to them for additional information on Medicare.
Actually, but my question is not about getting Medicare. It's what happens to the Medicaid waiver once the person starts Medicare, let's say in the fall. Do you lose part of the Medicaid waiver? Do you continue with the Medicaid waiver? What happens?
Oh, no, great question. And typically it is handled effectively as another insurance. So Medicaid is the payer of last resort. So when we're looking at a service to be provided, and again, regardless of if it's waiver, hospital, pharmacy, Medicare simply becomes another insurance that we evaluate as a potential payment source. But it will not affect the receipt of waiver services. For the majority of time, we don't see too many private insurances, and we don't see Medicare paying for the types of support that are provided through the home and community-based waiver programs. So the short answer is next to nothing will happen from your perspective or from the family's perspective receiving services. The one difference or perhaps a hiccup that might happen with the Department of Workforce Services is once there is the belief that Medicare eligibility is possible, they will require you to apply for the benefit, as we do require individuals to access all available benefits that they may have access to. Sorry for some redundancy there, but really from the receipt of waiver support, you're not going to see any significant changes.
Okay, so you answer the question. Yes, once you actually get on Medicare, you're still going to maintain your Medicaid waiver services. The only thing that I want to stress is that with Medicaid, if you were to get a prescription at a pharmacy anywhere here, you have to have it through a state local doctor. But with Medicare, you could use any doctor statewide. So I guess they would go through first, or nationwide. I think you would go through in determining who's going to pay for this. You would go first through Medicaid, and then if they didn't approve it, then Medicare would pick it up.
My understanding, and again, I could be wrong, you may have better information than I do on this, is that the coverage would attempt to go through Medicare payment first.
Okay.
And then we have what's called a crossover, where it should help in some situations to reduce potential copays, but they will take a look and consider pharmacy costs when an individual is duly eligible for both Medicare and Medicaid. But you're correct. It basically just creates a hierarchy of we will try to bill X insurance first, then Medicare, then Medicaid, as you're kind of going through.
Perfect. Thanks for your answer of not losing the waiver. Thank you.
Angie, you're on mute.
Thank you. So to the question, has every family been notified if they are going to receive funding? No, everyone has not been notified yet. They're being notified each month as we go, so that we're able to focus on families as we're bringing them into services, getting things set up, making sure that we're able to give the needed attention to get people set up, which is also why we're doing this over the year, so that we can have the time necessary to meet with families, understand needs, get plans in place, help them find their service providers. And as we've already talked about, we do have a finite number of staff, and the work, right? They work throughout the year. So this helps us to be able to get services to people as well as kind of manage that workload. And then the other question, are there emergency funds available for families? So one of the things that our division is allowed to do, like through legislative approval, is when someone leaves services for any reason, we're able to use that funding to bring someone new into services, so that we continue to serve people. And often that is done through an emergency review process. Sometimes that is a temporary need. For example, let's say a family member who is the primary caretaker is having surgery. They know they're not going to be able to support their family member over the next 3 to 4 months. They may request some one-time emergency services to be able to meet that, kind of bridge that need. Or we also have a monthly review where people have a request for emergency funds. This does have priorities, like if someone is experiencing, like they're unsheltered, or they have experienced abuse or neglect. So they are pretty critical emergency cases. If they present a significant risk to themselves or the community. So there is a means of requesting that, but like as with everything we have, it's within the funding parameters that we have, right? So the funding that becomes available is what we're able to use. So it potentially more people could be requesting services, emergency funds than we have, or it could be less, right? It kind of varies. If there are no additional questions, we just have a few things to share with you on upcoming meetings, but let's pause that and give Elizabeth a moment. Go ahead.
I hope that this helps. I'm very, very new at this. I have a situation where somebody has a oh, how do you say that? The individual has disabilities, but also has a criminal record. How do I help in that situation? Can you give me some direction? I'm kind of lost right now with it.
So, do they have service? I'll just try and give you some information, and then you can ask a follow-up question if you need. So we do serve people who have like law enforcement involvement. Often people with disabilities have been determined not competent, not always. I do know that a criminal record can make it difficult to find housing. So we do have a housing specialist that kind of helps people to figure out like how to find housing and do some problem solving there. But as far as services go, people can still receive services even if they've had law enforcement involvement. If someone is on the waiting list and experiencing this, I would make sure you contact their caseworker so that you can keep their records updated. So because that affects, right? It affects their overall need. And we want to make sure that their needs assessment score is reflective of their current circumstances.
Thank you. I think that helped. I'm still unshaken about some of this stuff, but I think that if we get on waiting lists and call caseworkers, I think we'll be able to navigate our situation. Thank you.
Okay, you're welcome. So the question, we are relatively new to Utah. Did I understand correctly that family members, such as parents, can receive funding for caring for their disabled child? So right now, what we have, so in Utah right now, a spouse can be paid as an ongoing support for their spouse. For parents and guardians, we have approval through what is called an Appendix K. During COVID, we've been able to make some adaptations to services to be responsive to changes and pressures of the pandemic. And one of the things that we've been allowed to do under the Appendix K authority is pay a parent or a guardian for providing the services. This is the Appendix K is a temporary change that only lasts as long as the pandemic is still considered active, right? As it's, I guess, declared every 3 months, whether we're still in a pandemic or not. And then an additional thing that the Centers for Medicaid and Medicare have done is allow states to have 6 months following the end of that to be able to transition, because our legislature provided funding through June of 2023. We'll be working with the Centers for Medicaid and Medicare Services. So Joseph, who was talking earlier, our Medicaid Long-Term Services and Supports group is who updates and does requests to the federal Medicaid so that we can like adapt our waivers to meet needs here. So we know that we'll have to be doing some work to make sure that we can have that through the end of this fiscal year. And so we only have funding through this year, through this fiscal year that starts July 1st and ends June 30th of 2023. And we've had funding through primarily like relief funds to make this available throughout the pandemic up to this point. We did receive legislative funding for the last 6 months of this fiscal year, so January through June of 2022. But it is for people, so it isn't just available to anyone. You have to be in services, and it's an option. So if you already have services, it's one of the service options available. And when we have one-time services for people on the waiting list, people have been able to access that as a one-time service as well. Typically, with caregiver compensation on the waiver, we'd need to have, we'd need to define extraordinary care. So what are the circumstances we would be able to use caregiver compensation? That's something that our state, if it were to be made ongoing, would need to like develop and make sure we had that defined. So there are some changes that would happen as a result if it were to move from an Appendix K to something that is ongoing. And honestly, we probably have to do it even for a short period if there's any gap between the Appendix K and when the funding from the legislature ends. So that is a really long answer for yes, we currently have approval to pay a parent to provide services. It still is based on need. It is still looking at, is this the best service and support for the person? So really long answer. I hope I didn't lose you in it. You are welcome. So it looks like we don't have currently have any questions. If you guys have questions later, please send them to dspdinfo@utah.gov and we'll respond before like our next quarterly meeting. You don't have to wait for that, but we do try to capture information when parents have regular questions. We do want to just let you know about some upcoming meetings. Our Disability Advisory Council meets quarterly. The next, pardon me, I actually should start with the next meeting for this self-advocate and family gathering. It's in August 10th. We have the two meetings. We have the one in the morning and the one in the evening to try and accommodate families and make sure that that we're as available as possible for differing schedules. We also have our Disability Advisory Council, which is on May 24th. That's a Tuesday. It's from 2 to 4. It's a public meeting. The public is always welcome to listen and comment and bring concerns. I think we have a link that we'll be able to put in the chat if you're interested in looking up more information. We have parent representatives on that Disability Advisory Council, as well as people with disabilities who are receiving services. You can review material and recordings of previous meetings on our website. And then the last thing I wanted to cover is there is an autism needs survey. Unless it looks like, did I miss something? Oh, NAMI. I felt like Olyvia had covered that. So there is also the NAMI Family and Friends Seminar. So that information was there. And then there is currently an autism needs survey. So Madison House Autism Foundation is conducting a statewide needs assessment to learn about the autism friendliness of communities. So it would be really valuable for those of you who experience this, have a family member who experiences this. I think you've got a link to the survey in the chat. And I just want to say thank you so much for your time this evening. Thank you for joining us. Thank you for your questions and participating. We really feel that the voice of families and people we serve are critical for us to understand how services are going, as well as like the direction they should take. So thank you very much for your time. Have a great evening.